Hi guys, my name is Dr. Mona Hardas. I'm a gynecologist from Flint, Michigan. I am a cosmetic gynecologist as well as a trained robotic surgeon. My passion is education. And today I wanted to talk to you guys about emergency contraception. There is so much misconception about this. Let me start by saying that the emergency contraception, it means exactly what it is. It's a contraception used in an emergency for prevention of pregnancy. It is not for causing abortion. Remember that it's not an abortion pill, it's prevention of pregnancy. So what is out there? There are few pills. Commonest one and the most well-known one is Plan B. There's one called Ella. There is another one called Next Step. There are quite a few of those out there. All of them are supposed to be used within 72 hours of unprotected sex. So within 3 days of unprotected sex. So who can use this? Well, as I said, if you had unprotected sex, if there was an accident with a condom, it broke or whatever, if you are on a birth control pills but you have missed more than 2 of the pills, or you are late in starting your birth control pill pack, or you are using a patch and it fell off, or you are on a Depo-Provera shot but you are late in getting the shot. In all these cases, pregnancy can happen if there's unprotected sex. So please, please, please use the emergency contraception. Has to be used within 72 hours of unprotected sex. That means within 3 days. Now, if it is over 3 days and you are still interested in an emergency contraception, talk to your gynecologist because we can use IUD up to day 5 as an emergency contraception. Not many people know about it, but yes, you can, so please call your doctor. Now, to get the emergency contraception, one of those pills which are out there, you don't need a doctor's order. You don't need a prescription. You can buy it in any of the pharmacies. And if you don't want to go to the pharmacy, there are some online sources where even Amazon, you can buy these pills on it. But take them as soon as possible. 72 hours is the max, remember that, but take it as soon as you had unprotected sex. Now, if you take it properly, it's really effective in 85% cases. It will prevent pregnancy in 85% cases. What can you expect, you may ask? Well, you may have nausea because it's a high level of a hormone and make you feel a little nauseous. You may experience some breast tenderness. You may have some headaches, some stomach upset maybe, but that's about it. Okay? So if you have a nausea, again, you can use the nausea medication because we want you to have that pill in you to be effective. If you throw up within an hour of taking the pill, then you need to repeat the dose because it is not going to be effective. So remember that. So when you get the prescription or you talk to your doctor, ask for something for nausea as well, just in case if you need to use it. Now, if you are on a birth control pill pack and you have missed a bunch of those pills, and that's why you ended up using the emergency contraception, then I want you to start a brand new pack within 2 days of taking the emergency contraception, okay? Remember, you're gonna have to, emergency contraception is only for that time. It's not gonna prevent pregnancy forever that month, okay? So continue using condoms if you have to. See your gynecologist if you need a different kind of a birth control because this one didn't work or you're forgetting to take the pill or your patch is not staying, whatever that may be. Make sure you make that appointment, see them. Now, once you take the emergency contraception, some people may have abnormal menstrual bleeding or spotting, but majority of them will get the period when it is expected. So continue using your birth control till your next period as well, okay? And then at that time, if you want to change it, again, talk to your gynecologist about it. I really want to emphasize that this pill is not gonna make you have an abortion. So if you are already pregnant and you use the emergency contraception, you're not gonna miscarry. You're gonna continue pregnancy. Now there are some case reports which are out there which have shown that people have continued with the pregnancy and the baby was born okay. There aren't any case reports saying it will cause abnormality in the baby. But again, really important to use it before you get pregnant, not after you got pregnant. But if you are, again, talk to your gynecologist about this. Now, can you use the emergency contraception twice the same month? Yeah, you can, but remember it's not a long-term contraception. It is for just a short term because you got worried. So don't use it as a long-term contraception. Go on something which is you can use consistently after talking to a gynecologist. I want to emphasize again and again and again that this is not an abortion pill. It is very easily available and you can just go and get it if you need it. So please protect yourself, use it properly, and talk to your gynecologist for other options.